morning, viewers. In this video, I would like to share about anti-protozoan drugs. I am Nandini, Assistant Professor, Sacred Heart College, Tirupattur. Definition: anti-protozoal drugs are used to treat a variety of diseases caused by protozoa. Anti-protozoal drugs used for following protozoal disease are amoebiasis, malaria, trypanosomonas, leishmaniasis, giardiasis, balanitis. Classification of anti-protozoan drugs: amoebiasis, chloroquine, dihydroemetin, digoxin, furin, emetin, hydroquinone, metronidazole, paromomycin. Malarial anti-protozoan drugs: malaria, artemisinin, chloroquine, melphagonin, pyrimethamine, pyrimethamine, quinine, quinidine. Trypanosomonas, merloperoxide, nephrotin, pentamidine, suramine. Leishmaniasis, sodium cybogluconate for giardiasis, metronidazole. Toxoplasmosis, pyrimethamine, giardiasis, metronidazole, itazoxanide, tinidazole. Common protozoal infection in human condition: amoebiasis, infected agent is Entamoeba histolytica. Giardiasis, Giardia lamblia. Trichomonas vaginalis. Malaria, Plasmodium species, Plasmodium malariae. Leishmaniasis, Leishmania donovani. Toxoplasmosis, Toxoplasma gonidae. Trypanosomonas, Trypanosoma cruzi, Trypanosoma brucei cambiensis, Trypanosoma brucei rhodensis. Drug used in giardiasis: nitroimidazoles, following metramidazoles, tinidazole, secnidazoles. Amides, nitoxinamides. 8-hydroxyquinolones, quinidinone, douglar. Nitroimidazoles: metronidazole, tinidazole, secnidazole. Mechanism of action: enters cells and gets reduced to highly reactive nitro radicals. Complex for electrons with electron acceptors generated by pyruvate peroxidase oxidoreductase PFOR. Act as electron chain, energy metabolism disrupted, cytotoxic effect. Metronidazole's adverse effect: most common anorexia, nausea, metallic taste and abdominal cramps, looseness of stools, urticaria, flushing, heat, itching, rashes and fixed drug eruption occurring in allergic subjects. Metronidazole indications: amoebiasis, giardiasis, Trichomonas vaginalis, anaerobic bacterial infection, Pseudomonas enterophilitis, acute necrotizing ulcerative gingivalis ANUG, Helicobacter pylori, gastroenteritis, peptic ulcer. Alkaloids: emetin, dihydroemetin, potent and directly acting amoebicides. Kills tropozoid, cyst not affected. Act by inhibiting intra-ribosomal translocation of tRNA amino acid complex. Administered by SC or IM injection. Emetin side effect: local irritant, systemic toxicity, nausea, vomiting, abdominal cramps, diarrhea, weakness, stiffness of muscles, myositis, hypotension, ECG changes, myocarditis. Dihydroemetin less toxic. Acute amoebic dysentery and amoebic liver abscess in patients not tolerating metronidazoles, followed by luminal amoebiasis. Chloroquine active against trophozoites of Entamoeba histolytica and gets highly concentrated in liver. Completely absorbed in upper intestine. Larger duration of treatment required. Higher relapse rate. Uses amoebic liver abscess 600 mg base for 2 days followed by 300 mg base daily for 2 to 3 weeks. Should be combined with luminal amoebicides. Side effect nausea, vomiting, difficult in accommodations, headache. Diloxynides furet highly effective luminal amoebicides kills trophozoites. Diloxynide furet DF is more effective. Unabsorbed fractions reaching the intestine responsible for therapeutic effect. DF hydrolyzed by esterase into diloxynate. Absorb no therapeutic activity seen. Glucuronide conjugated eliminated by kidneys. Uses intestinal amoebiasis asymptomatic cyst process after or along tissue amoebicides. Adverse effect flatulence, occasional nausea, itching and rarely urticaria. Hydroxynide prodrug active form thiazolxanide act by inhibiting pyruvate ferredoxines oxidoreductase PF4 is active against protozoal infections in Entamoeba histolytica, Trichomonas vaginalis, Giardia, Lamblia, Cryptosporidium, Parva, Helminth infections, Ascaris simplicus and Ascaris nana. Indications Cryptosporidium infection, Giardiasis, metronidazole resistance as well, Entamoeba histolytica, luminal amoebicides, side effect abdominal pain, vomiting and headache. Canidodochler luminal agents 8-hydroxyquinolones active against protozoa, fungi, bacteria and active against cysts present in the lumen. Indication continue intestinal amoebiasis, giardiasis, monilial and Trichomonas vaginalis. Treatment local treatment fungal and bacterial skin infection. Adverse effect nausea, transient loss and green stools, pruritus, edusm, goiter, acute reactions, fever with chills, angioedema, cutaneous hemorrhage, prolonged continuous use, subacute myelooptic neuropathy. Tetracycline adjuvant role, modest direct inhibitory action on Entamoeba histolytica. Older tetracycline reaches colon in large amount, inhibiting bacterial flora, symbiotic relation with Entamoeba histolytica. Indirect inhibition of Entamoeba histolytica. Chronic amoebiasis with only luminal infection. Paromomycin aminoglycosides antibiotic active against protozoa and helminthic as well. For intestinal amoebiasis should be given orally, no absorption, no metabolism, eliminated and changed in fecals. Uses amoebiasis, giardiasis, cryptosporidiosis, leishmaniasis. 500 mg 3 times a day for 7 days. Children 100 mg per kg. Treatment amoebic infections, acute amoebic dysentery, either tablet metronidazole 800 mg oral 3 times per day for 7 to 10 days. Injection metronidazole 500 mg IV injection intravenous 4 times per day till oral therapy can be instituted. And tablet form tinidazole 2 grams oral once a day for 3 to 6 days. And tablet diloxynate furet 500 mg oral 3 times per day for 5 to 10 days. Mild intestinal amoebic dysentery Either tablet metronidazole, same like that, 400 mg oral 3 times per day, 5 to 7 days. And tinidazole tablet also 2 grams oral once a day for 2 to 3 days. And tablet diloxinate for it 500 mg 3 times per day, 5 to 10 days. Treatment amoebic infections, amoebic liver abscess, either same like the tablet metronidazole 800 mg oral 3 times per day for 10 days. Injection metronidazole 500 mg IV injection, intravenous injection, infusion 4 times a day for 10 days. And tinidazole 2 grams oral once a day for 2 to 3 days. Injection in tinidazole 800 mg IV route injection daily for 6 days or till oral can be given. And tablet diloxinate for it 500 mg, same like that, oral 3 times a day for 5 to 10 days. Treatment of regimens in giardiasis. Metronidazole 400 grams 400 mg 3 times per day 5 to 7 days or 2 grams once daily for 3 days. Children 15 mg per kg per day in 3 divided doses. Metronidazole 2 grams single oral dose or 600 mg once daily for 7 days. Metronidazole 2g single oral dose. Nicotinamide 500 mg twice a day for 3 days. Children 7.5 mg per kg. Quinodolor 250 mg 3 times a day for 7 days.